Hello, my name is Raul. I'm a student nurse and I'm going to be performing for my practical 3. First, doctor's orders to remove a dressing, clean a wound, and apply to the wet to dry dressing. I'm going to show you what I'll be working with right now. There's no MPE sheets here, just what I'm going to be working with. So first I'm going to be demonstrating everything with my hands, so you won't be seeing my face, but you'll see what I'm doing with my hands. So this is not a sterile procedure. This is a clean procedure, so I am able to do this. I'll show you how my piston syringe, my saline, my basin where I will be putting my saline, and I have 3 surgical sponges. So first what I will be doing is I am going to pull furthest away from me, side, side, and then closest to me. I will place this down. I will be putting, this is a clean bottle, but if it was dirty, I would lip it. Now it's clean. I will be putting my saline inside of the basin, and I will make sure not to work over. Once I open these, I can't work over this because I need to stay as clean as possible. So first, I'm going to take one of the surgical sponges. I'm going to be throwing them inside the basin, so they're clean, and those are what I'm going to use to clean my wound. I'm going to discard this waist high, so my hands are remaining clean. I am going to open these now. Okay, I won't be able to work over that. We're going to be working over, and to save space, I'm going to throw this one on top of that one, so I have working space, more working space. So I'm going to be putting on clean gloves. And first we need to look at the wound. Let me just push this over here. We're going to have to look at it. So we're going to take off the wound nice and easily, because we don't want to irritate the skin or surrounding area. I'm going to pick up in the center. Now I'm going to assess this, going to look for consistency, color, change. If there's anything in the tissue, make note of that. Then I will close it up, take off my gloves with it, and then I'll discard everything. But in this case, I'm just going to simulate taking off gloves so I can save time. I will be discarding of that, simulating cleaning my hands, and I put on new gloves now. Now I'm going to be assessing the wound. At this time, just a note, head area will be this direction and legs down here. So if I'm going to measure, I would measure from top here to bottom, measure from here to here, and then I would measure depth. And with that, I could take a Q-tip, put it all the way down, mark it with my fingers, and then I'll be able to measure that, and I'll be able to get measurements on how depth, the length, the width of this wound would be. But next, what we're going to do is now we're going to cleanse it. So I'm going to take my piston syringe. I'm going to put it inside the basin. I'm going to take up as much as I need. What I have here. So now I'm going to have the patient on their side. So just so you can see, I'm going to have them on their side so it will be able to run down. This is least contaminated. This is most contaminated in this direction. So I will go from left to right. So I will go like this. Left to right. That was top. Now I'm going to go down. Middle is left to right. Then I'm going to go to the bottom, left to right. And then I will repeat that. Now I'm at the top, left to right, middle, left to right, bottom, left to right. I'll do it one more time. Top, left to right, middle, left to right, bottom, left to right. Now I'm done with that. This hand, I just was holding it to simulate that the patient's on their side, but I really wasn't touching the patient. So I'm done with piston syringe. There's no double dipping. There's no need for that. Now what I will be doing is I will be taking one of the surgical sponges here, and I will be trying out the wound. Let me just put this in the center for you. I'll be drying out the wound. So I could put this here, and I could damp inside. I could fold it up, damp, discard, This hand I touch, I'm working with the wound, so this is not my cleanest hand. This one's my cleanest hand. So I'll pass it over here. Now I will clean around the wound. So I will be drying out the skin also. So I will damp that, dry that. It's dry. Discard. Also, my gloves would have been changed after. After when I irrigated, I would change my gloves once again. Just wanted to say that. So I just cleaned the wound. I assessed it. I took measurements. And now what I'm going to be doing is now I'm going to do a wet to dry. So with my left hand, I'm going to reach into my basin. Trying to separate them. Okay, I'm going to wring it out. And I am going to spread it. This hand is clean, but it's only works with this wound. But this hand is still cleaner. So I'm going to open it up so that it will be able to air dry within the wound while it's packed. So what I will do is make sure I put it inside of the wound, not too tight. I will put it inside of the wound. Make sure it's not touching the surrounding skin. And I would use a Q-tip or tweezers, and I will push in my my gauze to eliminate dead space. And if I need more, I will pack it up more. In this case, what I can do is we don't want to pack it too tight because you want it to air dry. So it's packed. And I will just to eliminate more of that dead space, I'm going to wring out a second gauze. And I'm going to have that also packed in there. Just so that I can show you that we're eliminating dead space. So now this is a wet to dry, where over here we just packed it in. Now what I would do is I will get these last two gauzes that I have here that are sterile, and I will be placing over the wound, and I will be taping it down window panel style. So I'll be on the sides, on the side, and on the side. And on this piece of tape, I will note my initials, date, and time for that the future nurse will know how long this wound's been here since the last time a nurse had worked with it. So this is me removing the dressing. I cleaned the wound and I applied a wet to dry dressing. My second order is going to be doing administrating a soap suds enema. I did a NGT in lab with Professor Severino. Oops, just put some water. Sorry, I'm just moving everything over so that I can have you be able to look at my patient here. Okay, don't need that. So working the same area as we did with the last patient. Just to save space. So this is my patient here. I will introduce myself, make sure I have the correct patient. I will let them know what this procedure is, that I'm doing an enema, soap suds enema, to help them move their bowels so they'll feel more comfortable. I will position the patient in left sims, knee to chest in left sims, and I will be on their right side. So I wouldn't usually be on the side that I prefer. I'm a lefty, so I'll be on the opposite side so that I could work better and help the patient more during this procedure. So I would also have my gloves on. This is a clean procedure. My hands are a little sweaty. This is a clean procedure, and I will be And I had my enema bag filled up to 1,000 milliliters, and I will show you. I have the Castillo soap concentrate here. So what I would do, just to save more time, I would just open it to the side, insert at the top of my bag, and I will just shake up the bag until it's soapy, so that the water inside has soap suds. So first I have to prime this so I don't make my patient gassy. I have it locked, and now what I would do is I would lube up my enema tube. For an adult, it will go in 3 to 4 inches. For a small person, it will go in a shorter distance. So what I would do is tell the patient, taking a deep breath. I would insert it 3 to 4 inches because I'm working with adult, and then I will start releasing water with controlling this clamp about 100 milliliters. Or a comfortable rate, so that the patient is not in no discomfort. So what I will do is I will push down. I am now releasing water, but just to show you, I am releasing water, and I could slow it down, and I will stop. So I will do this until how much the doctor has ordered. And I will, once I'm done, I will take it out. While I'm doing this, I'm holding the patient's buttocks once I put in the tube, and then I'll take this out. Once I'm done, I would push this to the side, tell the patient to hold it as much as possible, and until they can't, then I would assist them to the bathroom, make sure they have a clear path, and I could either help them to the commode, and with their bowel, when it moves, I will take note of the amount, consistency, the color, and if there's any abnormalities. And I will also, during this process, if there was any cramping, I will stop so that the patient is not in pain. Thank you.